Adriana Alvarado, and I'm here to tell you a little bit about post-traumatic stress disorder, also known as PTSD. Now, imagine having to relive your most devastating encounters over and over and over again. According to Anxiety and Depression Association of America, PK Phillips suffered with flashbacks and night terrors his entire life, not knowing or understanding why he was feeling this way or even having these visions. He would feel endangered everywhere he walked. Every space for him was a danger zone. The mental, physical, and sexual abuse that Philip endured while he was a child up to his adulthood is what caused his disorder to develop. There was a point in his life where he was attacked at knife point, leaving him unable to sleep for 4 years straight alone. He finally got properly diagnosed at the age of 35 years old with post-traumatic stress disorder. He was a part of the 3.6% of the population who suffered with PTSD. Now, according to the World Health Organization, over 250 million people are victims of PTSD, meaning you can also be a small percentage of people experiencing it. With this being said, today we are going to explain PTSD. We'll go through what PTSD is, its effects, and how it can affect people, and treatments. Now, what exactly is PTSD, or post-traumatic stress disorder? PTSD is a disorder that is formed when someone has experienced a traumatic event. It usually stems on from a major injury or, again, a traumatic event. Depending on events you partake in will determine which type of PTSD you have and how it can be treated. Based on Best Day Psychiatry and Counseling 1994 to 2023, there are 5 types of PTSD, starting from the less severe types such as normal stress disorder or stress response, acute stress disorder, and uncomplicated PTSD. These ones are a little easier to treat as they usually stem from one trauma instead of multiple. Now, going into the more severe types of PTSD that take a little longer to treat as they stem from multiple traumas are complex and comorbid PTSDs. Like I said, these ones are a little harder to treat as they stem from multiple traumas, and these traumas usually are based off something very dangerous or something very traumatic in someone's life. Oh my God. Now we've explored what PTSD is, let's discuss the effects it can have on people. PTSD can cause someone to have other or develop other mental disorders. Examples of this are depression, anxiety, eating, and substance abuse disorders. This usually leads to either suicide, suicidal thoughts, or usually having to go back to a doctor's to get themselves checked out once again. These symptoms can worsen if disorder is already diagnosed within you and you are taking medication. Now, according to American Psychiatric Association, November 2023, PTSD affects the brain and how it regulates emotion. Because of this, PTSD activates the brain whenever a situation reminds the person of the traumatic event. These traumatic events can keep a person feeling stuck in a certain time of their life, making them reliving these events over and over and over again. Now that we've discussed the effects of PTSD, let's explore treatment options. There are 2 types of treatments for PTSD. We have medication and we also have therapy. Most people recommend the therapy as it has less side effects, but medication is also very helpful with PTSD. Now, there is only 2 types of medication that are approved by the FDA. That is sertraline and Paxil. It usually takes 4 to 6 weeks for these medications to fully work, but you will start to feel a difference between 2 weeks of taking it. You can either take these by mouth, or I'm pretty sure there's different other options if you aren't willing to take it by mouth. These medications help to stabilize your mood and the serotonin intake in your body. So both medications are technically an antidepressant. So they're usually called Zoloft and Paxil. Paxil is usually taken for adults 18 years or older, and Zoloft is usually used for children 6 to 17 years. So Zoloft is a little bit safer to use as it's used for younger children. While it can be helpful, there are some cons of taking this medication for even just for a little bit or for a while. they're taking these medication can cause an increase of suicidal thoughts, or if you got taken off the medication way too quickly, it can cause a withdrawal. And if taken this medication in large quantities, or if you mix them, it can cause a condition called serotonin syndrome. According to need.gov, 2 to 12% of people have had severe cases of syndrome. Serotonin syndrome is a serious drug reaction. It's usually caused when combining medications that both contain serotonin, so it makes your body and your brain have an overdose of serotonin, and usually it's kind of like a drug overdose. Now that we discussed the medications, let's go back into the therapy. So we usually use psychotherapy. It's a lot safer. The two usual ones we use are cognitive therapy and exposure therapy. Both of these are combined together to help you face your trauma safely, so you'll be able to learn to cope with them. So this is usually dealt with in a group, so you guys don't have to do it alone and you guys feel more comfortable. Now that today we learned about post-traumatic stress disorder, we talked about what PTSD is, we talked about the effects it can have on someone's brain and body, and we talked about the treatments. Remember, over 250 million people around the world have or is experiencing PTSD right now as we speak. You may not be having it now, but in the near future, you may end up experiencing even symptoms of PTSD, and you might need to get the help you need. So you may not have it today or tomorrow, but maybe in the near future. Going back on Philip's story, PTSD seems like an uncurable a disease, or what people say, but it can, there is no cure for sure, but there is ways you can help your symptoms and get better. He was able to get himself help and take control of his life. He made PTSD livable. You can too.